Hello, my name is Dr. Michelle Barron. I'm a professor of medicine in the Division of Infectious Diseases, and we're going to talk about coronaviruses today. Coronaviruses are things that we all have been exposed to at some point in our life. They're the common cause of the cold, and the new virus, which we're referring to as COVID-19, is a little different and very much the same. We know that it's been spreading throughout the world as well as the United States. We know that in some people it causes simple symptoms of runny nose, cough, sore throat, very similar to what you'd see with upper respiratory infections. Some people, though, are getting very sick from it and are developing complications, and there have been people who have died from this. It's spread through droplets, and so droplets is what you see when somebody coughs or sneezes and all that lovely little stuff that comes out. They can either land on a surface or lands on you when somebody coughs directly on you. Through that mechanism, it can spread actually pretty fast because we all live in close contact. We're constantly touching our phones and touching surfaces. Certainly children spread things like this pretty frequently in daycares, so it spreads pretty easily. Viruses in general don't like living outside of the body, but certainly when it does go outside of the body onto these surfaces, anywhere from 30 minutes to a couple of hours, a lot of it just depends on the temperature of the room, how much moisture there is, and the surface itself. There's some surfaces that viruses like to live on better than others. And so I think in general, though, they're not going to be there with over 24 hours or late on packages and things like that. There's been a lot of concern about those kind of things, and certainly I think it's probably overhyped and not really a risk of how you get this. Cannot live in a swimming pool. Chlorine will kill it, no doubt with that. We're certainly hoping that's the case, that warm weather will change the epidemiology of this. Certainly, if you look at other coronaviruses that we've seen over the years, typically in the summer months, they tend to go down and then they kind of resurge just when we start seeing flu in the fall and winter months. But I think it's too soon for us to be able to know that. So if you come into contact with someone with a known coronavirus, the current recommendation is that you would potentially quarantine yourself or monitor yourself for symptoms, fever, chills. The CDC has a wonderful website that helps people figure some of these caveats out and be able to discern that information. You can always talk to your provider as well and understand if this is going to have a potential impact on your health. Yes and no. So it all depends on how you use the product. So the key thing with soap and water is that you cover both sides of your hands, you rub them really well, and you got to do it for at least 20 seconds for it to really be effective. The beauty of the Purell or the alcohol-based sanitizers is that you put a quarter size, you don't need much more, you cover all surfaces of your hand, and then you let them dry, and then you're done. So that process really does still take about 15-20 seconds by the time it dries on your hands. The key is to not then itch your nose immediately or grab your phone, because then your hands are contaminated again. So just be very conscious of that. So you should see a doctor when you're having issues with breathing, if you're having chest pain, if you're not able to eat or drink. Those are all red flags that you're obviously getting sicker and you want to be able to get something done before it gets too severe, or at least get evaluated for that. For the individuals that have just runny nose and cough and maybe have a fever, mostly we're going to tell you that you're going to treat this symptomatically. Take Tylenol, take ibuprofen, make sure you're drinking lots of fluids. The recommendations are to not test asymptomatic people at this moment, but that certainly could change. I think we have a full picture of that because some people have such mild disease that they don't even really pay attention. The runny nose goes away, or they have allergies and they're kind of attributing it to the allergies that they have. Certainly there is some anecdotal evidence that suggests that people can still have some symptoms up to a month after the fact. Wash your hands, wash your hands, wash your hands. Be very conscious of your touching your face. It's amazing how many times in a day we itch our nose, itch our eyes, or grab our phone and then grab a sandwich, and we haven't really thought about what if I touched in the meantime that now I'm potentially introducing into my body?